This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
We're talking matters of the heart this week in honor of the big heart holiday on Friday.
And today we turn our attention to a condition that the World Health Organization recently described as a growing and serious global health problem. It's not heart disease, it's not heart attacks. In fact, it's not even heart failure. It's
something called atrial fibrillation, or AFib. And to put it into context, just how serious this condition can be, according to the American Heart Association, untreated AFib doubles the risk of heart-related death, and it causes a 4 to 5-fold increased risk for stroke. If that's not scary enough, many people don't even know they have atrial fibrillation. So what should you be looking for? How can you prevent it?
Joining us today with some answers is Dr. Stephen Keim, who is the Director of Electrophysiology Lab at Peninsula Regional Medical Center. Doctor, thank you so much for joining us this afternoon. So atrial fibrillation, what is it?
It's a disordered, rapid, irregular heartbeat that is a short circuit in the normal electrical activation of the heart. If you see on the tracings there, those are electrical tracings of the heart. The one on the top, labeled 1, is in atrial fibrillation. The one on the bottom is in sinus rhythm.
That's a regular heartbeat.
That's a regular heartbeat. That's right. So if you look at the red arrow, you see a very chaotic, very frenzied looking irregular activity, and that's exactly what fibrillation is. It's a chaotic electrical activation. Our word for quiver is fibrillation. So instead of beating in a normal, predictable pattern, the way you see on the bottom tracing with a simple hump, which is a regular ordered contraction, this is a very chaotic and very frenzied, so there's no mechanical contribution for the top part of the heart to the overall function of the heart.
Oh, okay.
The other thing you notice on that is the irregularity, and that's a very prominent feature of this heartbeat. There are other heartbeats that may be fast, but notice on the top the irregular patterns of it. The next spike, which is the activity of the bottom part of the heart, is not predicted from the previous one, whereas the tracing on the bottom is like clockwork. It's lub-dub, lub-dub, lub-dub. The tracing on the top is a little bit more like the cha-cha-cha. It's here and there, here and there.
And AFib can lead to more serious health problems, can it?
It absolutely can. It is both associated with all the realms of cardiovascular diseases that you'll be talking about this month with all the risk factors. It's associated with diabetes, with electrolyte abnormalities, with high blood pressure. So it keeps company with the things that we generally talk about with it, but as you pointed out already, the prominent feature, it makes whatever cardiovascular condition you might have significantly worse, both in terms of management patterns, both in terms of symptoms, but also there's a mortality implication associated with it. So it is very important that atrial fibrillation is identified and treated appropriately.
Okay, so who's most at risk?
Clearly, there is an age-associated increase, so that 5% of the population by the age of 60 will have experienced atrial fibrillation. 10% of the population by the age of 70 will experience atrial fibrillation, and it's estimated that 1 in 4 of us will at some point in our lives, earlier or later, have an episode of atrial fibrillation that will necessitate medical treatment.
Now the thing about AFib is those who have it may not even realize they have it?
That's correct. That's one of the conundrums and very confusing things for physicians to deal with. We have sort of 2 different patient populations. Some patients are absolutely devastated by the development of atrial fibrillation. They show up in the emergency room. They're absolutely convinced that something horrible is going to happen, and they just feel horrible. But much more insidious are the people who just notice, gee, I just can't walk as far as I did. I can't bicycle. We see this a lot in our sort of athletic types of individuals where they have a performance level that they've sort of learned to be comfortable with and associated with, and now they can't do what they used to do. And you know what? They're saying, I'm not that old to feel this old.
Right. So are there any particular things we can be looking for?
Well, I think the irregularity, we go back to that over and over again. Most healthcare providers are trained to take a pulse. Anytime you get your blood pressure checked, you get your pulse, and it will be striking, not just necessarily the rate, because this is frequently a very fast heart rate, but also with the irregularity of the pulse. So
Right.
either the individual patient or the healthcare provider can do it. The patient will notice that irregularity as a skip beat, okay? We talked about the lack of contribution, mechanical contribution to the heart. So that combined with the irregularity can create that sense of shortness of breath that patients will have. But oftentimes it's just a sense that, gee, I'm not feeling very well with it.
So how does a doctor detect it?
By the irregularity.
Yeah.
Almost universally, a physician will be warned by his staff that the pulse is irregular.
Is it a
and then,
mechanical thing that helps you detect it? Or?
well, it's the pulse. So that the bottom part of the heart, which actually delivers the contraction that makes the pulse that you feel in your wrist or elsewhere, or measure. That's what you measure when you measure your blood pressure. That is being directed to beat at a particular rate. The electrical housing, so to speak, the distributor cap, if you want to think of it in terms of automotive terms, is housed in the top part of the heart. So if all the wires are connected and it's appropriate, then it's a very regular lub-dub, lub-dub, lub-dub.
Right.
Can we prevent it? Is there
So-
something we can do?
The prevention is generally in the broader population directed at avoiding the cardiovascular risk factors of the heart-healthy lifestyle. There are certain behaviors that certainly put a person at risk. The caffeinated beverages,
Right.
which seems every other week changes whether it's good or bad. I think
Right,
what is
right.
fair to say is moderation. And I think that same is associated with alcohol.
Okay.
We frequently see a change in alcohol intake associated with more atrial fibrillation. There's an entity that we term holiday heart, frequently because patients' intake of caffeine or alcohol in and around the holidays is frequently increased, and we see an increase in the emergency room visits with that.
And when in doubt, ask your doctor.
When in doubt, ask your doctor.
Thank you
for
so
joining
much.
us.
And
Thank
if
you.
you would like to read more from Peninsula Regional Medical Center about atrial fibrillation, go to delmarvalife.com and click on the show tab. While we're talking about your heart, I'm sure a bouquet of beautiful flowers would just fill your heart with joy this Valentine's Day. Once you get those flowers, do you know how to make them last longer? We'll have simple steps you can take to make that happen.
But next, you may not have known that Delmarva played a unique role during World War II. WWOC Sussex County Bureau Chief Evan Kozlov stops by to tell us more about the prisoner of war camps right here on the peninsula. But first, is there something going on in your community? You know, we'd love to hear about it and talk about it and see the pictures from the event. Send that information our way, along with any pictures you'd like to share. Just send it right to us.
You can reach us, comments at delmarvalife.com, or like us on Facebook and share the info there. Delmarva Life, we'll be right back.